Good morning, everyone. So I think we can start. Good morning, ladies and gentlemen. This is Jamila from Friends of Cancer Patients. We are pleased to present today a health webinar about benefits of flexology for cancer patients in collaboration with the FlexoFix. I would like to introduce Mr. Carl Darien, CEO of FlexoFix. Dear attendees, before starting, we would like to inform you that at the end of the webinar or at the end of the sessions, certificate link will be shared. And if you have any questions, any comments, please do type it in the chat box, and Mr. Kyle will answer after the session. So, Mr. Kyle, good morning. Thank you for your time and support. Over to you.
Excellent. Thank you so much. I want to thank everyone for being here, especially FOCP for making this possible. I'm looking forward to explaining a bit more about flexology and how it can help, especially cancer patients, help a lot on development and recovery. So really quickly, FlexoFix is we're a company made of athletes, previous athletes in different disciplines. And we also have an extensive background in understanding body mechanics, body structure, and muscle therapy. Now, I've put together a small presentation, and that's going to help us kind of guide us through what I want to talk about, and especially the benefits of how flexology can help cancer patients. So allow me to share this. Just a moment. So what is flexology? So I'm going to talk about what is flexology. Flexology, in the fundamentals of it, is the realignment through the body, through the muscular chain. It's the realignment of the body through the muscular chain. It also helps improve mobility. It unlocks connective tissues and opens up the nervous system. And most importantly, it gives you awareness on how to strengthen and reactivate all those dormant muscles. So basically, it's a technique done on a massage table to help identify and readjust any muscle imbalances that you might be facing. We do this through 3 therapies. So neuromuscular kinematic mobility. We also do it through active release technique and fascial stretch therapy. So these techniques all incorporate into the fact that it helps you improve your mobility, unlock the connective tissue, making sure there's the body and mind awareness of how to move and what to move and where to move. So why do we say this? We say this because we talk about muscles all the time. We say it's very important for muscles to always be active. A lot of research go back to how important it is to always stay active and why is it? We got 3 pillars, and the most important one would be first of all, it's preventive injury. So the understanding of why we work with muscles and why flexology incorporates a lot of stretching, a lot of reactivation, is really to ensure that there's preventive injury. Second thing is to support any recovery. So we all know that it's very important that when we have any injuries or when we go through cancer therapy, we lose a lot of muscles. We go through treatments, we go through operations, and muscles will always be there to support us. So the stronger and the healthier the muscles are, the better and the easier it will be for us to recover. And finally, when we have this ability to move and our body is functional, we'll be able to move so well that metabolism and blood flow will completely improve in our system. So these are the main pillars of why it's really important to keep on maintaining your muscles and having a really strong background with it. We also truly believe that flexology can help people diagnosed with cancer to recover from surgeries and treatments. Flexology can be incorporated, and I truly believe that it could be incorporated in everyone's fitness journey back into their fitness journeys, after their cancer treatments. Because it starts very gradual. It is very specific to every single patient, And we look forward to really molding every single therapy session to make sure it focuses on the specific needs that each patient would have. Flexology also is really important to think about, because we know for a fact that it will lessen stress, it will lessen depression or anxiety that someone would have, because once we get to that certain level of activation, once we get that certain level of work, we're able to increase energy levels. We're able to give back more flexibility to the patients, endurance, motivation. It builds confidence. Why? Because we give you back control of your own body. The fact that we have you understand every single muscle activation and why is it going to activate and how is it going to activate gives you the opportunity to really take control back of your body. Now, with that being said, we will also talk about why we also do not pass the threshold of doing a certain activity or pushing you into different activities unless we have a full clearance of the doctors. Now, we want to stress on the point that it doesn't hurt at all. Those therapies are extremely slow, extremely patient, and it's a great way to start again that healthy lifestyle. Because when we go back after cancer recovery, you really need to start, even though you were active before, you really need to start slowly and consistently. And we wouldn't want to push it or ask someone to start running around. So being active on that massage table, having the ability to really focus on individual muscles once at a time is going to give you the opportunity to really have a better start after your treatments. I also want to focus now on the steps that we take when we start with flexology. So the steps are 3 steps. We evaluate, we experience, and we look at the results. So what does that mean? That means that every single session that we will do will incorporate an evaluation. So we will look at you, we will test you. We will do a series of tests that will help us understand the limitations and the abilities of you moving forward. From those limitations and the strength, we will capitalize and mold that experience. We will do the massage session on the table. We will focus on every single muscle. We will do different movement. We'll improve mobility. And by the end of the session, we guarantee a great result. So we'll test all the evaluation that we've done at the beginning. We'll test it again and do it again at the end of the session. This will give us a strong understanding of where we started and where we are. So with that, here are a bit of a process as well. So I'll go a bit more into details on what it includes and how you'll see the difference. So our recovery program includes a set of tests that will show you the muscles before and after showcasing. So as you can see on the top right-hand side, there's going to be motion tests. Everything is going to be measurable. Everything is going to be taken slowly and consistently. These measurable tests will help us understand and look at the progress that we'll be able to have every single time. So we have also the Y balance test, which is right here. So this is the shoulder motion test. We look at how well your shoulders are moving. And of course, once we know the range of motions and the way the shoulders move, we will know how to tackle the re-educational part of your muscles. We also look at the Y balance test, which is right here. Oh, apologies. So the Y balance test is right here. So it's a picture. And the Y balance test is to test the range of motion of the hip, the stability of the knees and ankle, and of course, the strength and flexibility of the hip as well. So as you can see, these are some of the very variable tests that we go through, and we help really identify every single thing. So as I said in the beginning of the session, every single test will help us identify different muscles and different sections of the body that we need to start focusing on. I want to go back as well to a couple slides before when we talked about the metabolism and the blood flow. It is extremely important for everyone to understand that when we have a strong muscular skeleton, we will be able to perform better. We will be able to move and do things at different levels. And this will help us gain a bit more confidence. This will help that blood and circulation of the entire system move much better. With that, I think I'm going to finish it off with Flexology is all about understanding our clients. It's understanding what they have been gone through. So we go a lot on really knowing the entire background of our clients, and we want as much as we can to really take our time with every single person. Why? Because we truly believe that we're not the same. Everyone has gone through different things. Everyone lives different lives and have different goals. And our goal is to really have your goal completely achieved. So I think that's pretty much what I wanted to cover. Hopefully we have questions and answers. If not, feel free to send us a message or check us out on Instagram. We also have a website. We'll post that later. So I'll leave the floor for questions and answer.
Thank you so much, Carl, for this informative session. So as he mentioned, we will be waiting for the questions and answers. If anyone have any questions, they can type it in the chat box and Mr. Carl will answer accordingly.
All right, so I can see the chat right here.
I think so far there is no questions. We just shared the certificate link.
Yeah. All right, well, we'll take a little bit more time, or would you want us to end it right here? No. Does your treatment replace physical therapy? That's what you mean. Our physiotherapy. So our treatment is always, it's in addition to therapies, to any other therapies. It's always in addition. So our treatment goes way beyond fixing one problem, because we look at a holistic point of view. So the fact that we look at a holistic point of view, we're able to target every single therapy. So the problem will never be where the knee hurts. If your knee hurts, for example, or your back, it'll never be where it is. It's always where it starts from. And this is why, because we look at a holistic point of view, because we do so many tests and we do so much exercise and we focus on every single different muscle group, that we're able to target that differently. Is it a short-term solution or a long-term treatment? Absolutely a long-term treatment. We always focus on making sure that, because, like I said, because we assess and have the awareness of your body, this is why this goes way beyond just one treatment. And because on the massage table, the patient is working with us. So we're not sitting there and stretching the patient in different motions, or we're moving the patient. Every single movement is being done by the patient, because it is extremely important for the body and mind to assess every single movement and be able to do it by themselves. So absolutely a long term, because it'll be muscle memory that continues. Thank you for the lecture. Would it be effective for scoliosis patients? Yes, absolutely effective. As we know, muscles are linked through ligaments and tendons and all the way to the joints. So re-educating the muscles to really try to work properly in a systematic way, in a functioning way, will definitely help in scoliosis patients. We also always do a lot of exercises. We also give you a lot of exercises at home to really fasten the process of recovery. So when a patient comes to us and we work with them, there's always little homeworks to do at home, little exercises to really help fasten the process of recovery and really get you the best outcome possible. Those are great questions. Sorry, I entered late. Was it possible to from the start? Sorry.
The lecture or the webinar will be available on FOCP YouTube channel, so she can get back later on to our channel.
Okay, excellent. How often should I have reflexology? So reflexology, we're doing flexology. So there is a bit of a commonality because we do work on pressure points, we do work on elongating the muscles and joints. So there's going to be a lot of repetitive movements. However, the fact that every muscle will be differently, it will be activated differently. Now, how often should you do it? It really depends on you. It really depends on every client. We will never have a single opinion about or a single answer because everyone is different, like I mentioned before. Everyone will need a different way or will react differently to it. Their muscles might be really active and really responsive, some might not. So we take our time to really identify those things. So it's very important for everyone to understand that it's not a generic section that we do or a generic protocol. We really do it based on every single patient. Yes, so a great stress reliever. It is a great stress reliever because, like I said before, the fact that we have this extreme blood flow that goes through the body after the session helps really throw in a whole lot of oxygen into your muscles, and this alone will help your muscles breathe, so you'll feel less tense and less stressed. That'll really set the tone to be able to really breathe in. We do also focus on a lot of breathing sessions when we find out that people have been living a stressful life. So when we get to know our patients and people are living a stressful life and going through hard times, we do a lot of breathing sessions. This will help really focus on themselves and themselves only and not what everything is around them. Office hours and chairs. So yes, like I said, every single stretch, every single activation will help solve this. Where is this treatment found? So we do it here in Dubai. We are located in Souk Al Bahar, and so we first started it in Lebanon, and then we also work with it in France. But mostly now we are completely focused in Dubai.
Yeah, I think we came. Okay, does one have to come to the clinic?
Yes, absolutely. We can do it at home, but we definitely recommend doing it from the clinic for at least 1 to 2 sessions, just so that we can analyze your body, analyze your functionality, how you move, how your muscles respond, and then all the homework and everything else can be done at home.
So I think we came to the end. I would like to extend my sincere thanks and appreciation to Mr. Carl for organizing such a useful webinar. And we hope that our attendees have benefited from this awareness program. And please stay tuned for more similar programs that will be announced later on the social media channels of Friends of Cancer Patients. So thank you so much, and inshallah we'll see you in the future.
Thank you so much, FLCP, and looking forward to working with you all. Have a great day.
Thank you so much.
Thank you.